We know already from several studies that alcohol is a risk factor for several types of cancer. The most important ones are the head and neck cancers. So how many cases we think are associated with alcohol worldwide? So we have this number of about 5% that comes from these big studies. And we know also that the greatest risks happen for patients that drink heavily and also long-term, right? So we consider one drink, for example, 1 can of beer, and that is equivalent to 1 glass of wine or 1 shot of hard liquor. So for women, up to 1 drink per day is considered moderate drinking. More than that would be heavy drinking. And then for men, it's up to 2 drinks per day. More than that, again, heavy drinking. So binging is different from what I'm saying about drinking every night. It's more about drinking a lot occasionally. So for women, what we consider binging drinking is 4 or more drinks in one single occasion, and for men, 5 or more drinks. And how does alcohol can cause cancer? So the biological mechanisms are not completely known, but we know some things. One of them is that alcohol increases estrogen. It also does increase the male hormones in the circulation. Second of one is that it appears to increase the susceptibility to the carcinogenesis, which is basically the mechanisms how cancer develops in the mammary tissue. So it also increases DNA damage, and there is some evidence that it can increase the potential for invasiveness of the breast cancer cells. And we know already that alcohol is associated with chronic tissue inflammation. So then the question is, how much can we drink? So our American Cancer Society recommends for men no more than 1 to 2 drinks per day, and for women no more than 1 drink per day. As oncologists, we are a little more conservative than that. So we usually tell our patients to try to minimize to 3 to 4 drinks per week. What about weight control? So we know that being overweight or obese increases the risk of breast cancer. And after menopause, most of the estrogen comes from the fat tissue. So basically, before menopause, our ovaries produce estrogen. And after menopause, the estrogen is mainly produced in the fat tissue. So that's why if you are overweight, you produce a little more of estrogen. So most clinicians use this measure, which is called body mass index. What it is a measure of the body fat, but it's only based on height and weight. When we divide the weight in kilograms by the square of our height in centimeters, and then we get a value. In general, if you have a number that is lower than 18.5, you're considered underweight. If it is between 18.5 and 24.9, you're considered normal weight. And then you're overweight if you are between 25 and 29, and if you're 30 or higher, this is what we consider obesity. But the goal with this talk is not to discourage anyone. So even if you found yourself in the obesity range or in the overweight range, what can we do, right, to improve that? And I wish I had something else to tell you, but it's still, it is still decrease calories, increase activity. If you hear something different than that, it's probably not true. So how can you decrease the calorie intake? One of the strategies is decreasing the size of food portions. So we know that the brain, it takes a little bit of time for the brain to realize that we are full. So if you eat too fast or if you put a lot of food in the plate, you tend to eat more than what you need. The second thing is to avoid food or beverages that are very high in calories, in fat, or in sugar, but does not contain a lot of nutrients. The third thing would be limiting the in-between meal snacks. So we know that if you feel hungry, it's not that good to skip completely the snack because you may be even hungrier at night, but not eating too much in between meals makes sense. Also limiting the processed meat and red meat, that is more important for prevention of colon cancer, but it's the recommendation in general from the American Cancer Society. And eating at least 2.5 cups of vegetables and fruits, and trying to prioritize whole grains instead of refined. So what about physical exercise? The mechanisms of cancer risk reduction with exercise. Again, we don't know all the mechanisms, but we know some. So one of them, as I said, is that it prevents weight gain. The second one is that it also reduces the level of estrogen when we exercise. There is also a decrease in insulin resistance, it lowers the insulin levels, and also decreases inflammation. And it appears to have an impact in immune function also, which also participates in cancer. During treatment is what our patients ask. It's a little hard to exercise right after surgery, and then sometimes when you're having radiation, chemotherapy becomes harder. But in the past, we used to advise our patients to rest during treatment, and now we know the opposite should be. If you're very tired, you can't do it, but if you're not that tired, our advice is to go for a walk and try to exercise a little bit, even during treatment. We know that 1 minute of vigorous activity equals more or less 2 minutes of moderate activity. The biggest example is walking fast without running, without jogging, just walking very fast. How fast should I walk? You are able to talk, but you're not able to sing your favorite song. So you can use that as just as an idea. And even if you can't do what is recommended, if you do some, it's already better than not doing anything. Even small things like taking the stairs, getting out of the bus one stop earlier, all these things do have an impact at the end of the day. So the recommendations are 5 times a week, 30 minutes, if you're gonna just walk fast. Ideally, you would do 5 hours, so you can say that the 2 hours and 30 minutes is the minimum that you really should be aiming for. And this it can include like a low pace of biking, for example, or if you're playing tennis with a buddy, so it's not only walking. But if you can't do that, you should do the vigorous exercise, because that you can do for less times. So the recommendation is to do about 25 minutes, 3 times a week. And ideally, you would do the same amount. You would do 30 minutes 5 times a week. Why do I say ideally? Because again, if you do more, it is better. And these include swimming, jogging, treadmill, and all of that. The only thing with swimming is that because you don't have the gravity, you get a little less benefit for the bone protection, but the cardio is excellent. You get the same protection. And then on top of that, you should add 1 to 2 a week of the muscle strengthening activities. That is not as much for cancer prevention, but for bone issues. So osteopenia, osteoporosis, the muscle strengthening activity has a very, very high impact on that. So yoga, push-ups, lifting weight, elastic bands, all of that. Thank you.